You know those incredible images, the X-rays, the CT scans, that give us a window into the human body? We always hear about the doctor who reads them. But have you ever wondered who the unseen expert in the room is? The person who actually creates that image in the first place.
Okay, picture this. You're in that scanning room, maybe feeling a little nervous in that hospital gown. The person who comes in, who explains everything, who positions you just right, and who operates that incredibly complex machine. Is that the doctor? It's a really common assumption, but the person who's actually capturing the image has a totally different, highly specialized role.
And this, right here, is the key distinction that gets missed all the time. On one hand, you have the radiographer, often called a technologist, who is the absolute expert in capturing the image. On the other, you have the radiologist, a medical doctor who goes through more than a decade of training to interpret that image. One is the master of the technology, the other analyzes the results. Think of them as two sides of the same coin. You can't have one without the other.
So what does this job actually look like? Well, let's spend a day in the life of a radiographer. Our morning shift, interestingly enough, doesn't start with the machine. It starts with the person.
You know, at the very heart of this profession is this profound ethical principle. And this quote from their code of ethics, it's not just some nice words on a plaque. It is baked into the DNA of every single patient interaction. It's all about a commitment to seeing the human being first, not just the part of the body they're about to scan.
And here's what that looks like in the real world. Before a single button gets pushed, the technologist becomes your guide. They're making sure you're the right person, explaining exactly what's about to happen, and making sure you're as comfortable as possible. They're the ones answering your questions, calming your nerves, and giving those super precise instructions, like hold your breath now, that are absolutely crucial to getting a perfect image.
All right, as we move into the middle of the day, the focus starts to pivot a bit. With that human connection made, the next priority becomes the hard science that makes all of this possible and safe.
And that science is all built around one powerful little word, ALRA. It stands for as low as reasonably achievable. This is basically the golden rule of radiation safety. The goal is simple but incredibly important. Use the absolute minimum dose of radiation you need to get a great image, and not a single bit more.
So how do they do that? Well, the first tool in their toolbox is time. It's super simple. Less time equals a lower dose. It's kind of like being out in the sun. The less time you spend there, the lower your risk of a sunburn. Techs are masters of being efficient to keep that exposure time to a minimum. Principle number 2, distance. Just like the heat from a bonfire, radiation gets way less intense the further you move away from it. Technologists use this basic law of physics to protect not just the patient, but also themselves and anyone else who might be nearby.
And finally, the principle you've probably actually seen, shielding. That heavy lead apron they put on you, it's not just for show, it's a critical barrier. They use it to protect the parts of your body that aren't being imaged, and just as important, they use it to protect themselves from exposure, day in and day out.
So we have this expert who is both a compassionate caregiver and a safety scientist. How in the world do they get there? As we head into the afternoon of our day in the life, let's look at the really rigorous path of education and training they go through.
The educational journeys are pretty different, but both are incredibly demanding. A radiographer will go through a focused 2 to 4 year degree program, which is this intense mix of classroom learning and hands-on clinical training. Now that's different from the 12-plus year marathon a radiologist undertakes, which includes medical school and a long residency.
And let me tell you, that clinical training is no joke. It's not just about learning from a book. Students have to prove they are competent in a huge range of actual, hands-on procedures. We're talking everything from imaging a tiny bone in the wrist to really complex spine studies, and even dynamic stuff like an upper GI series, where they watch things move in real time.
And get this number in your head, 36. That's the minimum number of different mandatory imaging procedures a student has to completely master just to qualify for their certification exam. This isn't about just passing a test. It's about proving you can do the job safely and effectively, on your own, every single time.
So who's setting all these high standards? It's the ART, the American Registry of Radiologic Technologists. You can think of them as the national gatekeepers. They're the ones who make sure every single certified tech in the country meets this really high standard of excellence. It's all about keeping patients safe and making sure the profession is respected.
All right, as our day in the life comes to a close, let's stop talking about these professionals and instead let's hear from them. What's it actually like to have this as your career?
First up, listen to what Becca, an X-ray and CT tech, has to say. She really hits on how dynamic the career is. It's not a dead end. You're always learning. After you get your first certification, you can specialize in all these different areas, what they call modalities, like MRI or mammography or ultrasound. You can really shape the career to be what you want it to be.
And then you have Carolyn, a CT technologist who's been in the field for over 18 years. For her, it's about opportunity and stability. She points out that there's always a need for this kind of work, which makes it not just a job, but a really solid, financially secure career for the long haul.
And I just love this last perspective from Erica because it brings everything full circle. Even after she moved into a different role, she says her radiography training gave her this incredible foundational knowledge of the human body. It's a career that doesn't just teach you how to see inside the body, but how the whole thing fits together.
So they're part technologist, part caregiver, part scientist, part artist. The next time you see one of those amazing medical images, I hope you'll think about the unseen expert in the room, the skilled, dedicated, and compassionate professional who made it all possible.